Let's talk about probiotics on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I am Dr. Liz Cruz and I have Tina Nunziato sitting right by my side. Hopefully you're watching us on YouTube and you can see us. Welcome. We're so excited that you're here. If you're a first-time listener, welcome to our podcast. If you're a regular listener, we love you and we love that you continue on this journey with us. So today we're going to talk about probiotics. I'm sure that everyone has heard about probiotics because it's such a popular thing. It's such a trendy thing. However, in case you haven't, probiotics, what are probiotics? Probiotics are basically good, healthy bacteria. Good, healthy bacteria that is so important in our lives. And
that's the end of this podcast.
Exactly. Thank you for joining us. We'll catch you on the next one. So why are they so important? So let's just back it up a little bit.
Back it up.
Let's back it up. So when I was going through my gastroenterology training back in 2000 is when I started, and it was a 3-year program, so finished in 2003. Back during that time, probiotics.
Back in the Stone Age, when Dr. Cruz went through her GI training.
Oh my goodness.
Oh my goodness.
We're going there? Okay. Yes, back in the Stone Age when I was going, actually, it is over 2 decades ago. All right, so back in the Stone Age, probiotics were just starting to surface and become known.
Become a thing.
Yeah, become a thing. And I remember that some of our mentors, some of my attendings, that's what we called the people, the women and men that were guiding us and that were, mentoring us during our training. Some of them were totally on board with probiotics and were really promoting them to patients, and others were still very skeptical about it and weren't so much promoting the probiotics. So it was good to get both sides, and depending what month, what rotation you were on, you might get somebody that was all about probiotics, and the next month get somebody where you would say, oh, why don't we tell the patient to start probiotics? And they'd be like, no. That's not really so much the case anymore, because over the years, it has definitely become a very trendy thing. You can find probiotics on the shelf almost in any, Walmart, Walgreens, CVS, almost anywhere you go now, you can find probiotics. There have been a lot of studies
done on them. So I think a lot more doctors specifically are hip now to probiotics and their benefits because of the studies, right? A lot of doctors wait for the studies.
Absolutely. Yeah. So now it's definitely much more of a known thing. However, I do run into people here and there who still are not familiar with probiotics, and so
or they confuse them with other things.
Yeah, or
they'll really
exactly. They'll think, I'll be like, oh, are you taking digestive enzymes? Oh yeah, and they show me, and it's a probiotic, and I'm like, this is a probiotic. They're like, oh, well, what's that? Mm-hmm. So there's still a lot of room for education on probiotics, and so that's what we're going to do today, because probiotics are a huge pillar for us in our practice, and we love probiotics. I definitely started using. So what school was I in? So after I finished my training, I was definitely on the train for probiotics. I love probiotics and started, my practice of gastroenterology for over 2 decades now. I have always promoted probiotics. I remember when I started, the big one on the market was Align. Mm-hmm. Do you remember Align?
It's still here.
Yeah, it's still around. And yep. I can't remember, is it just one bacteria or two?
One strain.
It's just one strain. That's mm-hmm. right. And so I used to tell my patients, especially those who had bloating or constipation or even diarrhea, I would tell them, you need to go to the store and get started on some Align, and you need to take it every day. And so, our story then has progressed because we actually now have our own probiotic. And for many years, patients would say, well, Dr. Cruz or Tina, what probiotic should I be on? And we would tell them a few good brands, what we thought were good brands. But over the course of the years, we then found other companies that had really wonderful ingredients in their probiotics. And eventually we started formulating our own. And it was really amazing and awesome to be able to tell patients when they would ask, well, what probiotic should I be on? Well, we actually have our own. Go to my office, or if we were at the office, we would show them what we had and say, this is what you should be on. So our probiotics are amazing. We have 6 strains of bacteria in our probiotics. And in addition to that, we also have some prebiotics, which is basically food for the bacteria.
So let's talk a little bit about why probiotics are so important. Right?
Yes.
So a lot of times people will think that they only need to be on a probiotic if they've been on an antibiotic. So we'll talk about that a little bit, but then I also want to talk about just digestive issues in general and what starts to happen with why probiotics are so important when we start having digestive issues. So obviously, most of those bacteria, all those bacteria are in the gut. 80% of your immune system is in your gut, right? So when you refer to your immune system, you're actually referring to the trillions of bugs that are in your gut fighting for you every day to stay healthy, right? So a lot of times those bugs can get off balance, and they can get off balance for a number of reasons. Stress is a big one, which most of us are very stressed. So if you live a high stress life, you find yourself you're high anxiety, high stress, your gut bacteria is probably messed up pretty bad. Your diet also has an effect on the gut bacteria. And taking antibiotics also is actually a huge major factor in our gut bacteria. And we are a very heavy antibiotic using society, right? Any little thing, we go to the doctor, they say, oh, get on this antibiotic, you'll be fine. So we take these antibiotics, and antibiotics kill bad bacteria. That's the goal, right? It's meant to kill bad bacteria in the body, so whatever infection you have goes away. But it also kills your good bacteria. And so usually people will have digestive issues right after they've done a round of antibiotics. And we have a ton of patients that come in. Just know that if you put them on an antibiotic, they're going to be having digestive issues after. That's why, okay? So taking a really good, healthy probiotic, especially while you're on an antibiotic, is really good for you. You actually should do it. So a lot of times people will say, oh, I'm going to wait until my antibiotic is done, and then I'm going to take the probiotic. You don't have to do that. You really should take it while you're taking the antibiotic.
I mean, and even on for
at least a month after your antibiotic,
month or two after,
just to reset the gut with all those good healthy bacteria, all those good healthy bugs. What you're doing is you're just resetting the gut. Okay, when you're having digestive issues, whether that's gas, bloating, constipation, diarrhea, a lot of times it's because the gut bacteria is off balance. Again, we've got more bad guys than good guys in there. Okay, and literally just by taking a good healthy probiotic every day, you're able to reset the gut, and a lot of those symptoms go away, okay? So that's really big for patients who are struggling with some of these really kind of generalized GI issues, but even for just overall well-being, right? Like we always talk about anyone over the age of 40 being on a really good probiotic, and enzyme for that matter, but we're just focusing on probiotics. Being on a really good probiotic every day, mainly just to keep your immune system strong and fighting for you, right? Because the immune system, like if you get sick often, you're always getting the common cold, or you're getting the flu, or even when you get yeast infections, right? Bladder infections, that's just you not having enough good bugs to fight things off. So if you have these things recurring in your life, you really need to be on a good, healthy probiotic every day just to maintain a super healthy gut and a super healthy immune system.
Absolutely, totally. And along the lines of what Tina is talking about with the antibiotics, the flora, which is all those trillions of bacteria in your intestine, gets very off balance. So not only with antibiotics, but even some of the other common medicines that people take on a regular basis, anti-inflammatory medicines. Which are those? Those are the NSAIDs, Motrin, Advil, ibuprofen, naproxen, Aleve, you name it. There are multiple NSAIDs that are out there. Those will also throw it off. People that are on PPIs, which are the proton pump inhibitors, those are the acid reflux medicines like Prilosec that you can buy over the counter. And actually nowadays you can buy several of those different PPIs. That's going to throw off this. And it's not just those. It's a lot of other medicines that just throw it off. Tina talked about the diet and the diet throwing off the balance of the bacteria. A diet that is rich in, sweets, a lot of sweets, processed food, junk food, fried food. I mean, you name it. So, and the big one that Tina threw in there, stress. Who doesn't have stress?
Right. Exactly.
Right? Who doesn't have stress? And the reason I wanted to emphasize that is because I have had a lot of colleagues, my own physician colleagues, who have questioned me about having, recommending somebody take the probiotics every day. And some of them, have said, well, I will have them take it for maybe a month, and then I'll give them a holiday off of the probiotic for like a month because I've heard that it's just too much. I'm going to tell you that we are in the school of thought that we all need a probiotic every single day because there is something in our lives, whether it's a diet or a medicine we're taking or stress, something that is going to throw the balance off. And like Tina said, 80% of your immune system is in your gut. That's very significant. So we are in the school of thought that you should be taking a probiotic every day, even if you're healthy.
Yeah, and then to go toward like what probiotic, because again, we get questioned that a lot, and why your probiotic and not somebody else's. So, so we have our Pleasant Probiotics. This is what our Pleasant Probiotics look like. Dr. Cruz mentioned the multiple strains of bacteria and the prebiotic. It is important to take a probiotic that has a prebiotic in it. A lot of people will take a separate pill as a prebiotic and a probiotic. You don't have to do that. They make probiotics with prebiotics in them, which is the food for the probiotic, so the food for the bacteria. It's important to take a probiotic that has many strains of bacteria, like you mentioned a line, right? A line only has one strain of bacteria, which is not great, right? If you're going to replenish the body, you want to replenish it with multiple strains of bacteria, okay? So doing that regularly is what's going to help keep the body strong, all right? So that's the first thing. And then, of course, the no fillers, which we've talked about on other podcasts. It's so important, especially with probiotics, to be looking at the label, looking under other ingredients, because probiotics is one of those key supplements that, again, because it's so popular now, there's a lot of companies making probiotics, and they're going to try to make them as cheap as possible. And the way you can tell if they're not really great quality is how many fillers are in it. So if under the other ingredients you see this laundry list of stuff, then you know that they're adding fillers to that product. So what that means is that in the capsule itself, let's say they'll fill it half with the probiotic and half with the filler to fill the capsule. And they're doing that so they don't have to put all probiotics in the capsule because probiotics cost money. Okay? Fillers don't cost as much money. So it's important to make sure you're doing something really clean, especially if you're trying to rebuild the gut because you just got done with antibiotics, or rebuild the gut because you're having digestive issues, okay? You don't want to be taking anything with fillers because fillers can actually cause issues in the body, and so you're kind of counteracting on what you're trying to accomplish. So taking something like a Pleasant Probiotic, which is, again, what we consider medical grade supplements, but at a reasonable cost, okay? Most supplements that you'll find, or probiotics that you'll find on the market that has the number of strains that ours has and no fillers, how clean it is, it's anywhere in the realm of $50 to $60 a bottle. These are only $35 a bottle, so you're getting a lot of really great stuff for a reasonable price, okay? So that's why our stuff, when people ask. A lot of times, too, patients will ask, well, I'm just going to eat yogurt, okay? Or I'm just going to eat kimchi, or I'm just... Here's the thing with yogurt. First of all, you would have to eat 20 yogurts a day just to get the amount of probiotics that's in one capsule. Okay? Most of us are not eating 20 yogurts a day.
Well, not to mention all the sugar you're going to get.
That's the other thing. Yogurt has sugar, okay? I don't care what yogurt you're eating, it has sugar. And bad bacteria loves sugar, okay? So what's going to happen is you're going to eat a yogurt, and all the bad bacteria is going to come and eat all the good bacteria before it even has a chance to settle in the gut. So yogurt is not the best way to be getting your probiotic, okay? And yes, there are other things that you can eat and consume. And I always tell patients, if you're healthy and you're not having digestive issues, and you're not taking meds, and you're not living a stressful life, and you're trying to just keep a healthy body, and you want to eat kimchi every day to get your probiotic, that's fine, okay? That's not most of us. And most of us don't want to eat kimchi every day. I don't know about you, but it's not my favorite in the world, okay?
As long as there's some rice with it.
Right, exactly. But again, it just depends on what your goals are, okay?
Right.
To me, it's a lot easier to take one of these every day than to worry about eating kimchi every day.
I agree. And to add to what Tina is talking about, the other thing that you want to make sure is that depending on the strain, so we have 6 strains of bacteria, you want the counts of those bacteria to be in the millions, billions. And if you look at our bottle, every single one, you're going to see millions or billions. And you want it to be of each one.
Yeah.
Of each one. You want high counts because those are live bacteria. So every day, those are going to be dying off. And so you want high counts, and you want as much as possible, you want to refrigerate it. I mean, we don't want that to be the reason that you don't get antibiotics. We've had plenty of patients, probiotics. We've had plenty of patients who've said, well, I went on a trip, but I didn't take my probiotics because they have to be refrigerated. No, take them with you. Yeah. I mean, it's best, and that bacteria is going to last longer if you refrigerate it.
Well, so to your point, right, like these are refrigerated before you buy them, and you should always buy a probiotic that is refrigerated.
Yes.
Because, again, you don't know how long it's been sitting on the shelf. So if you have a probiotic that's sitting on the shelf without it being refrigerated, those bacteria are dying a lot faster.
Right.
Okay. But once you get it home, as long as, yes, it's ideal to keep it in the fridge continuously as you're taking it, but a lot of people do forget, right? And I always tell them, as long as you're going to get through this bottle in 30 days, it's okay to put them on the counter and take them over the course of those 30 days. Or like you said, take 10 of them with you on your trip with you. Leave the rest at home in the fridge. That's okay. Okay. They're not going to lose anything just taking 10 with you. So that's definitely something. But to your point too about the multiple strains, the other thing that you're going to see on a bottle is it'll tell you 10 billion or whatever on the front. But then on the back, it just lists the probiotics. It doesn't tell you how much of each, okay? That's another key that tells you that they don't want to tell you how much of each, because typically the very first one that's listed is the one that's going to be 90% of the capsule, which is typically a really cheap probiotic.
Yes.
Okay.
Absolutely.
So that's another thing to look for.
And then the other thing too is have a lot of patients that tell us, oh, well, I'm on probiotic gummies, or I'm on probiotic, I'm taking a pill, a tablet, a tablet. Look,
Listen, Linda.
No gummies, no tablets, okay? You want to make sure what we have is a capsule. We have a capsule that is powdered bacteria, and that's actually the best form of your probiotic, okay? Like Tina mentioned earlier, the yogurts, no. A bunch of drinks that are out there that have a bunch of sugar in it, no. Gummies, no. Tablets, pills, no. You want a capsule.
Yeah, if you're gonna spend the money, spend it on something that's the highest quality.
Yes.
That's gonna give you the best results.
Absolutely.
Right? That's the bottom line.
And you can take those out of the capsule. Yeah. When our kids were younger, they couldn't take the capsule. And actually, we still have one that has a hard time with the capsules. You could take it out, put it in a little bit of water, and mix it up, and and you can have your child drink it.
We actually use them when we have sore throats.
Yes, absolutely.
We take a little bit of water. We open up a probiotic tablet. Or a capsule. We swish it around, and then we gargle with it, and then swallow right before we go to bed.
Did you just say tablet?
Right, I did. Yes, the capsule. So just coating the whole mouth and throat with the probiotic before going to bed. You wake up, no sore throat.
Yes, it's amazing. I mean, look, we could actually go on this podcast because we love probiotics. Huge proponent of probiotics. Take your probiotics, get probiotics from us. They're high quality, medical grade, they're pure, there are no fillers. They're awesome. And we are very passionate about our probiotics, as you can tell. So if you want to learn more about the probiotics, you have any questions, we would love for you to connect with us. You can go to our website, drlizcruz.com. There's a magenta colored button on the homepage that you can click. and schedule a free 30-minute wellness consult. And you can do that from anywhere in the world because it's done over the phone, okay? If you haven't rated our program, please rate us and please give us a 5 because it'll help other people just like you to find us. And lastly, if you haven't subscribed to our podcast, please subscribe so that you never miss an episode. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.